Welcome to This Week in Pharmacy. I'm your host, Todd Uri, founder of the Pharmacy Podcast Network. I am in New Jersey right now at the Explore event. It's the first user conference put on by PrimeRx, and we will be there today, Friday, October 10th through Saturday. And if you are here in New Jersey, make sure that you connect with us here. And we are so excited today. We have two amazing interviews and features, one with the IPC group, John Covello, and Illinois Pharmacists Association's executive director. I can't wait for you to hear this. And then a special guest. I am not giving it away. Actually, it's already in the title. What am I saying? Mary Cutter is here. I cannot wait for you to hear her and her passion and her work and her art. It's all today on This Week in Pharmacy. How things are changing so rapidly with PBM reform, and the impact is coming from the grassroots efforts of organizations like the NCPA and PUT and the state organizations that are just so key. We are so lucky to have a state organization on TWIRx today, Illinois Pharmacists Association CEO, Executive Director Garth Reynolds. I'm so excited to see you, Garth. How are you?
I'm great, Todd. Thank you very much for having me.
Absolutely. And John Covello, no stranger to the pods through IPC's relationship with the Pharmacy Podcast Network. It's great to see you, John.
Great. Yeah, I'm glad to be here. I'm the Senior Director of Government Relations for IPC, working under our Executive Vice President, Mark Kinney, with our whole team around the country and our partners, great partners in the states like the Illinois Pharmacists Association. So I'm real excited that we can talk about a really very positive development for community pharmacy in Illinois.
It was big news. And This Week in Pharmacy, we are featuring HB 1697. I feel like that airplane movie back in the day where he was like HB 19er, and then he's like, did I hear a niner in there? So this is HB 1697. Garth, I'm kicking this right over to you. Why don't you give our listeners a summary of what this is?
So House Bill 1697, or also known as the Prescription Drug Affordability Act, was the premier healthcare initiative this session from Governor Pritzker in looking at trying to address PBM reform from multiple different levels, mainly looking at access issues like trying to get rid of spread pricing, patient steering, moving rebates back to the employers and health plans, but also looking at just trying to really rip open and throw the curtains back and getting more transparency into this process, and a lot of different determinations of getting more data back to the state to really look into these issues, both on a commercial and in a public sphere. And that's the other thing too. It also helps align, because we have our managed Medicaid program, which has kind of been running, out on its own in a lot of ways, regulatory wise. And this finally puts them back under the umbrella of the Department of Insurance, saying, yes, you are still responsible to Medicaid, but you're also responsible to the Department of Insurance. But the last piece, and probably the biggest piece when it comes to what we're talking about today, is there's about $70 million that's being focused on shoring up pharmacy sustainability and patient access throughout the states. Because in Illinois, just like a lot of states, we have pharmacy deserts, both in urban and rural areas. And we've got 74 of our 102 counties are considered pharmacy deserts. And 4 of our counties don't have a pharmacy at all right now. And so this is a major access epidemic issue in Illinois. And this isn't just a rural Illinois issue. Part of that 74 is Cook County, DuPage, Will, Kane, Lake County, the collar counties around suburban Chicago are all, and the city itself, are all part of the pharmacy desert issue in Illinois. And so, what some of the sustainability part of this program is doing is really trying to expand our current existing critical access care pharmacy, which you had a slide up briefly that showed we started that program back in 2018, working with IPC and our pharmacy stakeholders in establishing that process.
Right.
But you see, there's been a lot of building a momentum with getting, pharmacy regulation of PBMs under and getting DOI more involved back in 2019 and getting the state to look at their own data and to realize that almost $200 million was found in spread in the managed Medicaid program in just 2 years. So it's $1 billion extrapolated since that time. And then just continuing more transparency and anti-retaliation audit protections for pharmacy. So this has been building. And for the governor to finally say, enough's enough, we need to make a massive change in this area was a huge momentum push for us and a huge morale boost for pharmacy to know that the state is finally has listened to all of our advocacy and is wanting to push this forward and really take a serious approach to PBMs and say the line is drawn here. We're going to start looking at you a lot closer and getting things more sustainable for pharmacies. But it doesn't solve everything, as we all know.
Right.
We've got more momentum to continue our advocacy. But I'll pull back so John can add in a little bit here. So.
Yeah, I mean, Todd, this is really an interesting development where Garth and I have been working on this probably for about 6 years, and the building blocks of previous laws we actually call it the Illinois model, where we're helping other states because we've been involved in the managed care reforms in California, New York, Ohio, a bit in Kentucky. We learned the lesson early on from the reforms in West Virginia. Huge advances, first a short-term reform and then a permanent one in Michigan. And we're working with other states, but getting this kind of study, Garth and I worked together to pass a law to mandate what the state auditor had to do and what information had to be provided to them, that setup of a study requirement and the results is really the template we're trying to use everywhere of getting governments to look at their own data to understand how they're getting overbilled. Basically, they charge the state one amount of money and they're paying the pharmacies less. Or in many instances, they pay themselves more than they pay local bricks and mortar community-based pharmacies. It's all spread by a different name, but I think it's easier for everyone to understand in the policy world, they're getting overbilled. And, in all these states, we've been doing this around the country. It's close to $1 billion that state governments have identified, like Illinois, to the amount of the overbilling. I mean, it kind of fills in very appropriately to our federal bill that Congressman Buddy Carter has pushed to do the Medicaid reforms to mandate this. So this is a really important first step. But, Garth, I know, this year was a big move. We got a lot of the commercial reforms of spread that they can't do and not paying themselves better and rebate pass through. That also benefits not just the commercial marketplace, but also the public employee state plan in Illinois, as well as this critical lifeline program for Medicaid managed care.
Yeah, exactly. And it'll be great to see, as other states have shown, what the state will see in savings as these initiatives go into effect, and they can kind of see that there's a lot more here that can be done if they really start holding the PBMs accountable.
Yep. And the evidence, Todd, is that the 6 or 8 states that have done these reforms already, again, their numbers, not the industries.
Right.
The governments have identified that it has saved them in cumulatively $1 billion.
Jeez.
So they were getting ripped off by $1 billion. Since the states that do the reforms, they've now saved $1 billion. That's $2 billion on it. And then there's another group where the states have sued, and Illinois was one of them, the biggest MCO, Centene, for this overbuilding. They're going to collect over $1 billion. That's $3 billion. That shows you that what we're talking about in the federal bill is real, the amount of money this will save of both federal and state taxpayers. And more importantly, still pay pharmacies at the full cost to preserve access. I know Garth and his colleagues, we always talk about the deserts, which is a crucial problem. But we also have a lot of members, whether it's IPC or Illinois Pharmacists Association or any state association. We have a lot of members that are cutting back on which Medicaid drugs they can afford to fill. And I've read some literature where even the insurance industry is now identifying those pharmacies that remain, or what they're calling keystone pharmacies. Think of a keystone in a building. They're kind of holding up the system of being the last ones left standing. And Todd, I know you go around the country, look, all of Rite Aid stores are now closed. There are certain states where, Pennsylvania being a good example, there's a real access issue now. So we're very hopeful that working together with the Illinois Farmers Association and everybody in the coalition that Garth put together, which was everybody in the industry working together, this will be an important part of preserving their ability to take in every Medicaid prescription presented to them.
This is a great update. Would you, for the listeners' sake, just go through the benefits of HB 1697? The cool people say HB 1697.
Yeah, so with the bill, like I said, it broke up into three categories, but really we get into these last components of just that we're going to be lowering prescription costs by improving access and lowering costs by, removing the blurred business practices that PBMs deploy. And one of the things that we didn't talk about here is that it also removes probably one of the most manipulated sector, and that's specialty pharmacy. The specialty designation does not exist in Illinois after January 1. And so this is in addition to that, that's going to change a lot of patient access. If you've got a pharmacy who can meet those qualifications to dispense that medication, then the patient can go to their pharmacist. This is about bringing the pharmacist-patient relationship back to the forefront. And this is a first step, a major step forward in making that a reality. And so, in addition to all the transparency measures, one of the things we didn't talk about in the pharmacy sustainability, this also requires an annual dispensing fee survey to be done as well. And the goal is to have that being performed by one of the colleges of pharmacy to be able to provide the expertise review in that calculation of knowing the factors that need to be utilized in that. Because we do have some national studies, but they don't come around enough to keep moving with the economy as it ebbs and flows. And then also, just lost my thought on it. But then we're also going to have on part of that transparency, which is very important. The three top PBMs every 5 years are going to have full market conduct analysis done. And what's great about it, it starts in 2026. So we come out the door, the top three are going to be put under the microscope. So I'm hoping that will incentivize more compliance to the rules and to the new legislation from the PBMs, because we've not seen them be fully compliant in other states.
Yeah. And, Garth, you raised really important points. There's about 8 states now, Todd, that do periodic costs to dispense surveys of pharmacies to find out what their true costs are. But to put Garth's point in context, there hasn't been a national study since before COVID. So think about what's changed in the last 6 years since that last national study's been done. A lot more states are starting to look at the cost of filling a specialty drug, of what, that's got to have a differentiation. And, great examples, there have been forefront states like West Virginia and Tennessee and I know New York is in the process of doing these conduct studies. And, they're finding beyond simply scofflaws where they're not complying with what the law requires and, providing real penalties and real enforcement actions to show the PBMs they're serious about this. I mean, we all know this or are in this industry. We always talk about the big three, but you really have 5 big ones that control 90% of every prescription in this country. And while it may not technically meet a monopoly definition, it's certainly monopolistic where they're controlling everything. And it's a dysfunctional and an economically perverse system that's operating. So these reforms, just on that alone, beyond the Medicaid provisions, are giving real teeth. And, Garth, I'm real optimistic. You have an insurance commissioner
Mhm.
who worked in the healthcare industry. So hopefully Director Gillespie, is going to use everything she learned from her years of being on the other side to know what to go look for.
I've been very encouraged with her with her drive in not only her testimony but her actions with the department of late, and very glad to have her leadership right now. Um as I've said on many other avenues, I don't want her to ever leave this position. I want her to be there forever because we're glad to have someone who
Right.
knows and understands and knows where to hold these entities accountable. And so we're glad for her leadership and her dedication, and being a partner and listening to
Right.
everyone about their experiences, which
And
we didn't
and
have in
and
the
it's
past. So,
and it's important, we see this IPC around the country.
mhm.
This isn't a red or a bluish or purple or any other color. It's
Right.
really about green.
Yeah.
Republican states, Democratic states, split states. Everybody is doing the same thing. All the state governors and state legislators are woken up to a basic fact. The PBMs aren't saving them money.
Right.
And some plan sponsors are finally waking up to this too. We know the damage it's done to patients and to pharmacists, community pharmacies as their providers. But the plan sponsors are finally seeing their the way they conduct themselves and their lack of accountability even to them who are paying their bills is woken them up to the fact that reform needs to be done in Washington. But the good news is for anybody listening, reforms are happening in state after state.
Mhm.
And we now have a number of states that are really trying to get to cost-based pass-through reimbursement for pharmacies. We doubled the number of states that have done this year. But put it into context, Todd, in the Medicaid managed care states, we now have 33 states that either still pay it themselves at a cost-based system directly from Medicaid called the fee-for-service carve-out, or they mandated it within their managed care programs that they have to follow that same steps. I mean, that's significant reforms we've had. Oh, I'd say certainly in the last 8 years.
Yep. Hey, Garth, you have to promise to come back and give us an update on This Week in Pharmacy, because this has been wonderful news opportunity to get something happening right now, get you on. And John, you guys are amazing, always giving us the insights that we really need to share, because what's happening in Illinois is going to impact the rest of the nation. People are going to be able to follow up with it. So want to thank you both for being on This Week in Pharmacy.
Well, I
Great.
appreciate that. And just one quick thing,
Sure.
we talked about, we've got a program out here for critical access pharmacies that
Right.
right now the department, you have to attest for the new, we're doing an annual one-time attestation for them to be eligible, and, sign up. Let the state tell you whether you qualify or not. Don't wait, because if you wait, you're going to be left at the end of the line waiting for 2027. So act on that. You'll see links to it from us, and you'll see links to it from the department. So please make sure to act on that
Yep.
before October 31st.
Yes, you have to get those applications by October 31st. What it really means to the bottom line, Todd, for managed care, you're going to go from getting fees that you probably get right now from a managed care entity anywhere from 75 cents. You will be getting $15.55 for each qualified Medicaid managed care prescription. Or if you're in these rural counties and you got to re-up it, people, so get those applications in, you'll be getting that directly from the state too. So this is real money. It's in line with what's been done in other states, and it's what we're doing to deliver policy results that really are tangible of what you'll see at the counter to keep serving those patients and not to turn away any Medicaid prescription because you cannot afford to fill those patient needs, and leaving them in a lurch as to where they can get their prescriptions filled anywhere.
And there's going to be an additional $25 million support program. We're going to know a lot more about that by the end of fourth quarter this year. They're still working on the application eligibility process. And so we'll have a lot more information about that soon. But Todd, I really appreciate you letting us talk
Yeah.
about the success
Yeah.
we've had here, And enforcement and implementation is how we make sure that this is a win for everyone, including our patients. So we appreciate everyone's support, and thank you very much for
Great.
having us today.
And Todd, as we get to know more of those details, there'll be another opportunity for us to join you again on Pharmacy Podcast.
Come on back to This Week in Pharmacy and tell us. We'll be looking forward to this update in the fourth quarter. Hey, hold on. We have more to come on This Week in Pharmacy.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
One man's grave is another man's paycheck. RX meds at our expense. Forget the coal mines, they hit a gold mine. Hooked us on 6 feet of side effects. Like a wolf chest in sheep's clothes. The devil wore a lab coat.
Hey, we're back with more This Week in Pharmacy. We get to talk with a lot of healthcare providers and different kinds and people that are doing just amazing things. Shout out to our nurses and physicians that work with our pharmacists every day. And the stories that I hear from other podcasters about you just blows me away. What about Matthew Zachary? Matthew Zachary has cancer when he's young, 19 or 20, thought he was going to die, was very angry about it, creates Cancer Sucks, and recovers from cancer. And now he is a global force to reckon with, and different things that Matt Zachary is doing. So this platform, I always want to bring other people in, like Bill Schmitnick and his wife, that are fighting the greed through the Patient Protector, and how Patient Protector is really bringing more notice. And this through it's his mission and his goal because of the loss of his son Cole. But I run into other people, aren't necessarily healthcare providers, but their hearts are in change, and their hearts are in helping other people with the broken, bent system sometimes that we have, and the greed that sets into our healthcare system. So I get inspired by talent that uses their God-given gifts to speak to others through song or through comedy. And this happens to be song. So I'm not sure if you've ever been into the new wave of country or the mix-up of some of the new beats in country, but I want you to go look at marycutter.com. That's Mary, CUTTER.com. Look in the show notes. And right now, live here on TWIRx, I would like to welcome Mary Cutter to the show.
Oh, I'm so excited to be here. Thank you for having me on, and let me start my video. I hit it the wrong way. Now I'm back. Oh my goodness, I'm so excited. Thanks, Todd.
You're so welcome. I'm just blown away because you're using your talents to talk about what's happening in our world to the real people out there, and people that you know and people that you've met, and things that have happened to yourself. Just shout out streaming on Spotify, The Devil Wore a Lab Coat. And this is just so well done. And so talk to us, where did this passion come from to be so poetic, to kind of use your talents to bring attention to some of the things that are unfortunately happening in our healthcare system?
Well, this is the thing. I was born and raised in Kentucky, and I saw with my own eyes what the opioid epidemic was doing to my hometown. And I mean, just to give you a little taste of what has went down in Kentucky, there was a college, it was a very respected college, that they ended up shutting its doors a couple of years ago and turning it into a recovery center, a rehab center, because there's more of a demand for that than folks going to college. And you just think about that, oh my gosh, and I I live in Nashville now, and for the last couple of years, I've been making my bread and butter writing songs for other folks to sing, folks like Bailey Zimmerman, Nate Smith, Alexandra Kay. But I found myself very naturally, leaning into writing songs about something that, songs that tell a story. And that being said, it's just been on my heart to tell the truth about what happened where I was from. And so I wrote this song called The Devil Wore a Lab Coat. And the song just fell out. It was a really fast song that we wrote. A lot of times, for any folks that don't know much about the songwriting world, 5 days a week, all throughout Nashville, folks walk into a writing room. There's normally 3 or 4 writers in the room. They'll have their guitar, their keyboard, and they'll bounce around different song ideas, titles, and then they'll write a song together. And that's how most of the songs are written that are on the radio. And usually our writing sessions 3 to 4 hours. Well, I'll tell you what, lab coat, for better, for worse, my co-writers and I, we started talking about it, and it just fell out in like 45 minutes. And that's really fast for a song to be written. But I think it's just because we're just writing from our hearts. And I didn't know how it was going to be received whenever I posted a little snippet of it online. But what blew me away was the comment section, how I knew what had happened in Kentucky. And that's what I wrote about, just the devastation that still folks are trying to come back from. But I was looking in the comment section and folks are like, I'm from Massachusetts. It happened here too. People down in Georgia, people out west. I mean, it was all over the place. And it's really been crazy now playing it live in all different places. I was out at Oklahoma a couple weeks ago, open up for Hank Jr. It was my first arena show, which was very exciting. But even after, thank you. But I played that song in the arena. And after the show, I had a little meet and greet, and when I tell you how many folks came up and talked about how that song touched them, and they started telling me, I had 2 different people, tell me about loved ones that they had lost.
Mhm.
Then, one person that told me that how they've been clean for 10 years and, how they have been roped in as well, how they have been a victim of it. It's really mind blowing. And this was out in Oklahoma. You know what I'm saying? So it was nationwide.
It's something that I intimately understand. I was honored to be the director of business development for a opioid use disorder medication assisted treatment center that really put the value of the patient first instead of the dose and go. Sometimes these methadone centers are more about taking advantage of someone's addiction and now it's a life thing that they're just it's a fast food market. Pharmacy goes through the same thing. Whereas now we were dialing into the individual and really starting to look at their lives as whole and families and people. And then we started bringing in pharmacy services where we're like, hey, listen, not only are you addicted to an opioid and we're weaning you and we're getting you better and a little bit more freedom, but now you have diabetes or you have hypertension or something. And it was the whole patient. It wasn't just drive, because I remember many of these people that we got a chance to talk with and that were open to talking with me because I wanted to know what's valuable to you from the service that you're getting. And they were like, I'm treated with respect here. I'm like, I don't feel like I'm a junkie per se, or I don't feel like I'm being treated differently because I have this disease. And that's what this starts with, is you're calling it out and you're doing it with respect to the people that you have this song from their perception and from your perception. And it's true. And it's up to people that are listening. It's up to our pharmacists and our technicians and our nurses and our physicians to protect the patient.
100%, man. And I'll tell you what, it's hearts like yours that make the change. And there's a lot of, this is the thing that's so crazy. I don't know what the percentage would be, but I'd say 98, 99% of folks in the medical world come in with a great heart and great perspective, great brains, obviously. And they really are there to help people, but it's like the old expression, one bad apple can ruin the whole bushel, and that being said, you're right. It kind of made me feel a little something whenever you said how treating folks with respect, because you're right. People can feel, you know, uh, all kinds of ways and not a good way when they find themselves addicted to something. And the truth of the matter is, whenever I wrote The Devil Wore a Lab Coat, my hope was that just folks felt seen. And if one person, that's gone through this, feels not alone, in the aftermath of it all, my job here is done. I hand the keys to you, because y'all really are in that industry. But it's a wild thing, but kindness does go a long way.
I tell you what, there are pharmacy conferences, national pharmacy conferences that we go to, and I'm going to tell you, Mary, I'm reaching out to these conference creators because I would like nothing more to go to one of our national conferences and have you as the headliner entertainment for us, because not only are you speaking, because I've been to conferences where we've had some amazing bands that are extremely famous and well-to-do, and that's great. I just think that there's something to an entertainer that not only is talented from that music position that we all just want to just party and listen to some good music, but the digging down into the substance of much of your songs are just part of it all. And when I was young and I would listen to I'm a lot older than you, Gen Xer here, and I'd listen to like The Cure or something, and my mom would come in and listen to my music for a little bit, and she'd be like, "I'm worried about you because you're like listening to this depressing, dark music." And I'm like, but it actually makes me feel better, even though it seems like down and depressing, whatever. And your music is anything but depressing. But what you are doing is you're addressing something in this amazing tune and the beat and just the style, but you're calling it out. And that's why people keep coming up to you, because it's like, wait, I went through this and now there's this song about it that I can relate to.
Thank you, Sugar. That really means a lot to me. And gosh, I honestly am. There's been lots of artists before me, that have, used their voice for, writing songs for change, and not every song has to be, this call to action, activism situation, but I'm just writing from my heart. But you're right, though. Isn't it crazy how, I guess it's like anything else, how, sometimes people have used parables to, spread their message. It's the same kind of thing with a song, but I do like music that rocks. And so, even with Lab Coat, I was like, how do we make this where we can run on a treadmill while listening? So that was the goal.
I love it. I love it. Mary, where are you coming next? So you can give a shout out to the pharmacists and our technicians and people throughout that are in the hospital systems and the community pharmacies and taking care of our seniors. Where can they?
I'm going on my first headlining tour in just about a month. I'm so excited. So I'm going to be in Georgia. I'm going to be in Ohio, going to be in a bunch of towns in Tennessee and Kentucky, going to be up in Illinois as well. And everything can be found on my website. It's Mary Cutter, and Cutter with a K, like a cut paper, but with a K. And we have all the show dates on there, and folks can grab tickets. But I'm so excited. It's going to be really fun.
This is terrific. I don't see you in Pittsburgh, but
Not yet, baby. I can't wait to get up there, though.
It's gorgeous this time of year. You're missing when the leaves are at their greatest on fire level of changing. But you guys get some good foliage too there, so it's a beautiful time to be in Tennessee.
I've met a lot of really good people that are down here that are born and raised, Pittsburgh folks, and I can't wait to make my way up there too soon.
Go Steelers, right?
Oh, yeah, baby.
Well, I love it. Thank you so much, Mary. This has been such a treat. I appreciate you being here on TWIRx.
Thank you, Todd. Appreciate you.
By a decent alibi, you can say what you want, but tombstones don't lie. Strong towns tore down by little pills. So with a smile, don't care when it kills. No coincidence, no conspiracy. It just is what it is. It's our history. One man's great.
As frontline healthcare providers, pharmacists like you understand the importance of personalized care, especially in acute pain management. Ural Pharma is dedicated to providing high-quality, generic products tailored to meet your patient's needs. The company aims to serve a diverse range of patient populations, including athletes recovering from intense training, weekend warriors managing minor injuries, and those seeking a practical and mess-free option for acute pain management. Keep Ural in your toolbox of pain management options and join the ranks of pharmacists leading the way in personalized care. To learn more about Ural Pharma and its products, including full prescribing information, boxed warnings, and important safety information, visit uralpharma.com. That's YARAL pharma.com and connect with them on LinkedIn.